Our exercise is just learning to identify whether anxiety is too high or too low. That may seem unusual to you because usually we just know that people are anxious. Fortunately, because of medical knowledge, we know that anxiety is discharged in the body, and it's discharged through the central nervous system. So when anxiety goes in the somatic nervous system, you ask for a feeling, patient goes, they sigh. Or you might see them clench their hands like this, or clench their hands like this. Or you see them tense up their shoulders. They're getting tense in their voluntary muscles. That's a sign that they're getting anxious, but the anxiety is not too high. And it's actually safe to explore and help them face what they usually avoid. When anxiety goes into the parasympathetic nervous system, what happens is that the patient starts to have anxiety in their gut. They'll have like nausea in the stomach, feel sick to the stomach, maybe they need to go to the bathroom. These are patients who report having Crohn's disease or irritable bowel syndrome. These are also patients where they'll report with a rise of feelings in session, they start to get a migraine. It's because it activates these smooth muscles that line the digestive system and the blood vessels. So for patients whose anxiety goes there, it's really too high and we need to regulate it right away. Likewise, if the anxiety goes into the parasympathetic branch even more, blood pressure drops, breathing rate drops, pulse rate drops, and so not enough blood actually goes to the prefrontal cortex. And so when you have really anxious patients, they have trouble thinking, they have trouble remembering. Sometimes they even report having blurry vision or ringing in the ears. And these patients, the anxiety is just way, way, way too high, and it has to be regulated. Otherwise, the therapy is just going to be way too frightening for them to manage. So what we're going to do is we're going to do a little exercise. It's the first one on anxiety. And Alex is going to demonstrate different symptoms, and then I have to identify whether the anxiety is at the right level where we can explore, or if it's too high and we need to explore it. Okay, Alex, you'll be my patient and I'll be the therapist, and you'll see how we do this first exercise. Right, a sigh. That means anxiety is in the striated muscles and that we can explore. Anxiety is not too high.
I'm feeling kind of sick to the stomach.
Right. So that means anxiety is going into the parasympathetic nervous system and anxiety is too high. I need to regulate it.
I think I need to go to the bathroom.
Another sign that anxiety is going into the parasympathetic branch, it's way too high. We need to regulate it.
You know, I just feel this kind of like knot in my stomach.
Now that's interesting, isn't it? The knots in the stomach are from tension in the muscle wall. So that actually means as anxiety is going in to the somatic nervous system, it's actually safe to explore feelings.
I have to admit, like, I almost feel kind of dizzy now.
Right? And that's a sign that anxiety is way too high. The patient's anxiety is going into the parasympathetic nervous system. Here's a case where we definitely have to regulate anxiety.
I think I feel okay. I just feel kind of nervous, you know. I feel my heart beating a little bit more.
So the fact that the heart is beating a little bit more means he's anxious, but it doesn't sound like he's too anxious.
So, John, I remember when we started doing this, it was a little bit weird to be able to be so specific about the anxiety.
It really is, isn't it? I mean, I remember when I first was hearing about, you know, the parasympathetic branch and the sympathetic branch and this, somatic nervous system, I said, what is this? Yeah, I never learned that in university training. No one talked to me about, you know, the body and anxiety, right?
And the idea that you can do different interventions depending on the level of anxiety. It's also very new for a lot of people, I think.
It was new for me. It was strange to me. I just thought like anxiety was just like, well, I'm afraid what's going to happen tomorrow. I thought it was a thought in my head. I didn't realize it was like a feeling in my body. And I remember too learning it, it felt weird in a way to do something different than what I'd used to, because I wasn't used to paying attention to anxiety in this way. It just felt, I mean, I wanted to learn something new. I did want to learn something new, but I noticed that when I was learning something new, if it was different than what I'd done, it didn't feel comfortable, right? It was new, it was different, it was unfamiliar. Right. And it felt a little uncomfortable doing something than my old habit, which was, you know, I actually never really knew how to assess anxiety that way before. Right.
So, and I also get the feeling that at first it's uncomfortable, but then it's also almost relieving to get a sense of mastery over what you're seeing.
Absolutely, because I hadn't realized, oh gosh, I've been working with some of these patients with their anxiety too high, and it was such a relief to know, oh, if they're dizzy, or even just to know to ask for those symptoms. I didn't know to ask. And it turned out there were people that they had like symptoms in their stomach I'd never known because I'd never asked. And once I knew to ask, I said, oh, thank goodness, now I know. They're not too anxious. Yeah, yeah.
Great.
So as you're doing these exercises, if you notice it feels a little odd or a little strange, join our club, because we've learned that every time we do something new or we're learning something new, it feels unfamiliar. It's new, and you've come here to learn something new, but when we learn something new, feels uncomfortable, feels unnatural in a way, because what felt natural to me was my habit. Right. That felt natural. It didn't mean it was natural, but it was familiar. And so as you do that exercise, just notice that, and just get used to asking these questions, because it's the most wonderful thing if you can find out anxiety symptoms you didn't know about. That way you can regulate the patient's anxiety and really co-create a safe place for exploration.